Opioid-related overdoses are not an urban problem, a suburban problem, a rural problem. It's in all of those particular areas, and it's across the whole state of Massachusetts. We looked at all of the data. Opioid-related overdoses emerged as one of the paramount issues. The number of deaths that were happening each year had dramatically increased from 1990 up until 2006. There was a dramatic increase. I think when we actually, the year we applied or got the funding, there were about 635 people a year dying from opioid-related overdoses, roughly 2 people a day. We had to identify a specific issue, and that was literally our issue of focus: prevent, reduce unintended fatal and non-fatal overdoses. When we first actually told the federal government that that was the issue of focus for us, this was a primary prevention grant. We were at first told that we would not be allowed to focus on that particular issue because it was more of a harm reduction approach. But we used the data, we followed the process that they had written into their grant, and when we demonstrated that to them, they said, "You did what we asked you to do," and we were allowed to get that funding. In 2005, 2006, when we went for this grant, and then we went through the whole assessment process, and we identified opioid-related issues, overdoses for us as the main issue. We were the only state at that time that was funded to do this kind of work. This was a 5-year federal grant. To go through the process that the grant required us to go through, which was the assessment process, the development of a plan at the state level, that took us a year. We had to bring together all of the state officials. We had to bring together all of the people who contributed to this plan, identify all the data, and do this. 1 year of the grant was then gone. We then had to ask the communities also to go through an assessment process. This was unlike anything we had done before. Frequently, we had given out funds and we said, "We want you to spend the dollars on this." Identify a program, identify a strategy, and then go implement it. That wasn't the approach we took this time. We asked the communities to go to your community, look around, gather the data, talk to the people who were involved, key informant interviews, and you tell us how this is playing out in your community, and then you tell us what your plan is going to be to impact this. And you have to choose within a universe of evidence-based strategies that we will provide that are most likely to have an impact on those issues that you identify. They began to see the value of the approach because then they identified particular strategies that they could use that were most likely to have an impact on the problem there. If in a particular community, and this was true in a number of communities, there was a reluctance to call 911 because of fear of the police or fear of incarceration, that was more clearly identified. We identified the fact that parents and bystanders needed to be educated about emergency response breathing. We identified the response that addiction was not as well understood by many of the public safety officials and what it meant and what was happening perhaps in the lives of many of the people who were addicted. There was also the experience of learning that anybody was vulnerable. This was an issue, this was something that could happen to anyone or anyone's children. And that was also a great learning experience for many people. How do you keep these things going when there's no new money, but there's no increase in money, and yet the need is so dramatic? And one of the things that we did in our most recent grant allocation was we asked communities to work with each other, to work with communities, or adjacent communities, contiguous communities. We asked communities to peer or to mentor one another so that they could take the learnings from one community and share with neighbors so that we could have a greater impact on any number of communities. When Narcan first came along, probably right around the time that we got this grant, 2005, 2006, this was new for the police also. This was kind of strange. It was another drug, if you will. I think as the police became more knowledgeable about the fact of what this was and began to see how it could dramatically reverse an overdose, that spoke for itself, that you could save a life and give someone an opportunity to actually have another chance at recovery. To me, one of the biggest successes of this has been that family members and caretakers have something available to them, that they have the opportunity to reverse an overdose if it's happening in their house at that time. Our program began to give us an opportunity, and we have a long way to go, to help people start to understand about a little bit more about addiction and what it is and the stigma that's attached to it, and come forward and talk about it and make it less of a stigma so that people are more likely to seek intervention and recovery, more likely to ask for help. Police departments and many other public safety officials now understand addiction in ways that they never understood it before. I think there's a greater realization, although we've once again got a long way to go, that you're not going to arrest your way out of this problem. People are going to have treatment. They're going to need help to recover, and people do recover. I think police and many other public safety officials now believe that. You don't do prevention once. You have to keep doing it over and over again. And people ask me frequently, what do you mean by that? And the analogy I use is like fire prevention, right? You don't do fire prevention just once. You don't put up your smoke detectors just once. You don't just put in a sprinkler system in one building. You do it over and over and over again. And the reason you do it is because the costs of not doing it are so high. What's really interesting now is 2013, fast forward, the number of states that now have this as a major issue has grown dramatically. It is really amazing to see how this has become a major issue in so many other states across the country. And we are talking to many other states about the different things that we tried and we do.